we have listened so much about the how to manage the infertility in cases of male hypogonadotropic hypogonadism, female hypogonadotropic hypogonadism.
Jaideep, full screen, please.
Yes, but I'm not the. This stop bar arrow screen is coming in place. Now is it visible? Not full screen.
Yes, sir.
So in these all things, we have to basically handle with the ovum and the sperms. And for that, we require the technologies to preserve them so that it can be used in the future aspect also. So, so in the brief introduction, I will be discussing what is cryopreservation. It is the cryopreservation refers to the process of cooling cells and tissue and storing them at sub-zero temperatures in order to stop all biological activities and preserve their viability and physiological competence for future use. This is an applied aspect of cryobiology and which means the study of life at low temperatures. And ovum and sperm cryopreservation are the process of preserving reproductive potentials in man and woman for the later use. And if we go into the history, then if we even in Mahabharata times, there was incidences that they have shown that they have preserved the ovum and sperm. They have done the IVF. They have done the test tube babies. So, but in the recent literatures, if we have to look for the cryopreservation of the human spermatozoa was introduced in 1960 and has been recognized as an efficient procedure for management of male infertility. Gamete and embryo cryopreservation have been there, and it is the backbone for any IVF unit and accounting for the steadily increased number of the births worldwide. And on regular basis, we are seeing that several patients are born with the IVF. I am getting several references here from several IVF specialists for their thyroid profile or diabetes management. So the incidences by the IVF birth is increasing. I think it is approaching approximately 5 to 10% of natural births. So first, we will discuss about the sperm cryopreservation. All of us must have seen this movie in which they have shown that sperm is very important for the continuation of the progeny, and it has to be preserved properly, and it can be used for the later uses. And what are the needs and benefit for the sperm cryopreservation? That it is very important to preserve fertility for the man. So important thing is that it is for those patients, those who are going to be undergoing the cancer treatment or have to undergo prostate or testicular surgeries in which the sperm quality can get hampered, or those who are having to plan for the vasectomy, and all at high risk professions in which there is high exposures to the chemicals, radiation or extreme heat and can cause sterility, or are suffering from the ejaculatory dysfunction as already have been described by the Kalpana Das ma'am. And sperm freezing is also used by the men who want to make their sperm donation in sperm bank. And gender reassignment surgeries, which are very recent, and in Bengal, they have got the permission of penis and the uterine transplantation also. So the men who want to give birth to his own child in the future with the implanted uterus can use this sperm if the sperm preservation has been done. So what is the technique? First is the semen has to be collected, then it has to be processed and preserved by freezing, and then whenever required, it has to be utilized by thawing process. So first of all, semen collection is something in which the initial screening is done for the infectious diseases like HIV, HPV. If it is the patient is fit, then the masturbation is the simplest method to collect the semen. But if the patient is not willing for that, or a person is not willing, then other methods are available like disposable penile vibrators or electroejaculation or sperm retrieval techniques from epididymal or the testicles as described by the Kalpana Das ma'am in the previous lecture. And then those collected sperms has to be preserved by freezing, and this can be done by either slow freezing or rapid freezing. But whenever freezing will be done, there will be ice formation, and if ice crystals are formed, then the chances are there that the cell will get damaged, and any cells can get damaged. So to protect the cells, cytoprotectants are used, which are low molecular weight and highly permeable chemicals, which are used to protect spermatozoa from freeze damage by ice crystallization, because it basically reduces the freezing point. There are several cytoprotectants used. And in the slow freezing, I will just say that it was first described by Berman and Savda, in which consists of progressive sperm cooling over the period of 2 to 4 hours in three-step manner, either manually or automatically using the semi-programmable membranes. But if in the manual method, there is simultaneously decrease in the temperature of the semen, and the addition of the cytoprotectant is done in stepwise manner after unplugging the samples into the, and then the sample is just dipped into the liquid nitrogen to achieve the temperature of minus 196 degrees Celsius. So what is the from room temperature when it is collected? It is slowly reduced to 5 degrees Celsius by reducing the temperature at the rate of zero point 0.5 to 1 degree per minute, and when we reach 5 degrees Celsius, then it is taken to minus 80 degree by cooling at the rate of 1 to 10 degrees Celsius, and once minus 80 degrees is achieved, it is just dipped into the liquid nitrogen. Sorry, the admission was. Yeah. And rapid freezing was proposed by Mr. Sherman, and in this technique there is direct contact between the straws in which the semen is stored and the liquid nitrogen vapors for approximately 8 to 10 minutes, which gives the gradient for the temperature from room temperature to approximately minus 80 degrees, and then it is immersed into the liquid nitrogen. And as I told, that liquid nitrogen gives the thermal gradient and it functions as the distance. So farther the distance from the liquid nitrogen, the nitrogen vapors are hotter, and nearer to the liquid nitrogen, it is on the cooler side. So when this gradient is achieved, so that's why the straws are kept in the horizontal position, so that the temperature difference is not much between the lower end and the upper end. And then in this, the samples are initially mixed in a drop-wise manner with the equal volume of the cytoprotectant. Whatever amount of the semen is there, that much amount of the cytoprotectant is added, makes equilibrium is achieved, and then it is utilized. And then thawing process. Because now once the temperature activities has ceased, so it generally may be preserved. But once it has to be used, then again that semen has to be utilized, so that that semen has to be utilized. So it has to bring back to the normal room temperature, and that process is known as thawing, and it is equally important. And pre-freeze semen parameters have shown to be accurate predictors for the post-thaw semen motility and viability. And it can be done either ways, initially for 10 minutes in room temperature, then at thermostat, or both at thermostat and water bath, or just maintaining at room temperature for 15 minutes. So once the semen is thawed, that semen has to be separated from the cytoprotectant, which can be done by the conservative medium washing and the centrifugation. And what are the, we have seen just good side right now, that we have collected the semen, we have preserved it, we have used it. But there are some drawbacks also which can lead to the, which can affect the sperm integrity. As compared to other cells, sperms are less sensitive to cryopreservation damage because of high fluidity. As we know that maximum cells in our body have approximately 70% of water, but sperm cells have just 50% of water. So they are less likely to have water ice crystal damages. Despite this, cryopreservation may lead to some unwanted changes in the sperm structure and function, and maybe because of thermal shock, intracellular and extracellular ice crystal formation, cellular dehydration, osmotic shock, and which may also affect the sperm ability to fertilize the egg and achieve the viable pregnancy. So there are reports that just 60 to 70% sperms are viable once they are post-thaw. And there are reports that even if the cryopreservation is done, then the DNA of the sperms get damaged. But there is no agreement in literature, because few case reports, few studies says that damage is there. Some studies say damage is not there. But it's still, it is being used in since last 60 years. We know that it doesn't have much effect, and much DNA damage is not there. Now coming to ova cryopreservation. This is something which is very new. And egg freezing is very important, and it is safe and helpful to preserve the fertility in women, those who don't want to conceive in their reproductive age group, or those who want to delay because of some reasons, or those who are going to have some medical. I will just discuss those. So, in contrast to sperm and ovum freezing, oocyte cryopreservation was largely neglected until recently in late 90s, maybe because of disappointing survival, fertilization, and pregnancy rate. And but because of legislative restrictions, religious and ethical concern regarding the production and freezing of supernumerary embryos, some research was accelerated to preserve the oocytes. And with that, significant technical advances happened, and there are established procedures by which the oocytes can be preserved now. And the first birth with the cryopreserved oocyte was reported in Australia in 1986 by Chen. So these are the current fertility preservation techniques, like protecting the ovaries by GnRH agonist or Ufalexi, ART techniques, oocyte retrieval, like oocyte cryopreservation, IVF embryo cryopreservation, or metaphase stage 2 oocyte retrieval, and the germinal vesicles, and these are stored, or the ovarian tissue retrieval, tissue cryopreservation, and then that ovarian tissue transplantation. So these are the some techniques by which fertility preservation have been doing till recent time. And these are the most widely practiced. Embryo cryopreservation is the backbone in IVF centers. Oocyte preservation is also the backbone, and ovarian tissue, it is experimental right now. So what is the need for overpreservation? So there can be medical reasons, there can be non-medical reasons. Medical reasons, as already discussed in the previous lectures, that in IVF, the ovum is there, the sperm is there. The ovum has been collected, but the male partner does not is not able to produce the appropriate amount of sperm. But an ovum collection is something which is very tedious, and all the IVF experts will tell about that. It is really difficult thing. So once it has been collected, we can't waste it. So it has to be preserved for the future use until unless the good appropriate amount of sperm is available. And women who are at risk of early menopause, maybe because of autoimmune diseases, or the women who are candidate for surgeries for prophylactic excision of ovaries, maybe BRCA carriers, or surgeries that could involve excision of the ovaries, or the women, those who are detected with cancer and are undergoing cancer treatment. And for non-medical reasons, it allows the reproductive autonomy to the woman and can be used for elective fertility preservation in women who are conscious of age-related fertility decline, but not ready to become pregnant at moment. So this was something which has given women autonomy. And there are examples like the Google company is giving this options to all the women employees, that they can preserve their ovum, and so that their career doesn't get affected because of the pregnancies. And these are the various celebrities from the international, and the Mona Singh from India, those who have preserved their ovum, because when they were at the peak of their careers, they can't afford to get pregnant and destroy their career. So this is something which can be used this can help in giving the reproductive autonomies. So what is the method of over cryopreservation? Oocyte cryopreservation is almost exclusively performed at metaphase 2 stage and is considered an efficacious approach. First, egg collection has to be done, which is really very difficult because ovulation induction has to be done, which had its own complications like hyperstimulation syndromes, and several times the patient might require admission for egg collection also. This the IVF expert will be telling very well. And then that once the egg has been collected, it has to be freezed with the usage of cytoprotectants, because there are chances that the egg may get damaged because of the ice crystals. There are two techniques, the slow freezing technique and the vitrification. In this technique, initially the higher concentration, in vitrification, higher concentration of cytoprotectant is used, and rapid cooling is done with no time for intracellular ice crystal formation. At present, it is the most popular and most commonly used. Slow cooling was used earlier, but the results were disappointing. So it is not used at present time, in which it is just like the sperm cooling, in which there is phase cooling. Initially, the temperature is brought down to 5 degrees, and the amount of cytoprotectant is added so that it remains maintained, then 5 to 80, then 80 to 196. but it has not shown very good results. So vitrification is something which has shown it is a milestone and in the IVF treatment. And the most protocols used has been described by the Grama and colleagues, and it is two-step procedures. In the first equilibrium phase, for approximately 5 to 15 minutes, cytoprotectant solutions are used. It is equilibrium is maintained between the ovum solution and the cytoprotectant, and then oocytes are moved to the vitrification solution, for which it will take approximately 1 minute in the vitrification medium, and then it is transferred directly to the liquid nitrogen at minus 196 degree storage. So these are the various differences between the slow cooling and vitrification. Slow cooling is something which is not very much dependent on operator's skill, but vitrification is very much dependent on operator's skill, and that's why high specific training is needed and learning curve is there. The reproducibility of the result is high with the slow cooling, maybe more it is disappointing, and it is variable because of the operators. So now, as we have discussed, that the sperms are sensitive to the injuries. Same way, the oocytes are sensitive to the cryo injuries. Maybe because of large size, high content of water, and they have special intracellular content in their ovums. The sperm just has to give the DNA, but all the other things like the mitochondria, all the ribosomes, all the endoplasmic reticulum, all these intracellular organisms come from the ovum only. So they are more prone to get damaged. And the factors which influence the oocyte cryopreservations are the physical aspect. Physical aspect means the patient, the ovum and the several organisms may get damaged. And another is the biological aspect. Biological aspect is there is premature hardening of the zona pellucida, because if we will be suddenly cooling the ovum, then the outer surface, which is zona pellucida, will get hardened, and the ability of the sperm to go through this zona pellucida is impaired. That's why several times ICSI is required in the oocytes which are cryopreserved. And there are chances that the damage to the mitotic spindle apparatus may happen, because we know that the oocyte from the birth itself are in stage 2 metaphase. So there are chances whenever we are damaging the ice cooling very rapidly, the chances are there that the mitotic spindle apparatus may get damaged and may lead to aneuploidy. And but reports are not there, and then DNA fragmentation may happen because of, again, same way, cooling, rapid cooling leads to ice crystal formation, and the damage may happen to the DNA, and damage to the intracellular organisms like mitochondria or ribosomes or endoplasmic reticulum can happen. Parthenogenesis is something which is told that it is without fertilization, the ovum can give birth to the embryo, and then it may continue or not, like it happens in insects or the plant. But still, no case reports are there. The probable reason for this is that the cytoprotectants may stimulate the division of the ovum, and but still no reports are there. And in vitro aging, as we know that eggs, in eggs, they are formed from the conception itself, and aging happens, and by the time of birth, approximately just 16,000 eggs are there in the baby. Then these aging continues, and that's why the menopause happens by approximately age of 40s and 50s. So if we are preserving the egg which we have collected in the woman at the age of 35 or 40, the chances are there that that aging may continue, and the risk of syndromic babies may be there but not reported yet. And the epigenetic risk is also there because of the change in the telomerase sequences. So this is the overview that the physical stress can be there, cytoprotectants injuries can be there, and there are injuries can be there because of rapid cooling and warming, and there may be change in the surface and the volume ratio because of the sudden cooling. So this is the overview of changes which may happen because of this. And in future, there are chances that until now we were discussing that just we have some gonotropic agents, we can preserve oocytes, we can preserve ovum. But now the chances may in future there may be the agents which may improve the tissue grafting, which may eliminate the risk of receding cancers, and then there may be the times may advance that to such an extent that reproduction will become a different entity only. So I will just thank you all for the patience hearing and my note with the simple saying, which was the article which was published, which so much advances in the reproductive technologies. Then the origin of human sexuality was for procreation or recreation, which has to be answered later on. Thank you. Thanks a lot. Thank you for patience hearing.